So, welcome to your very first lecture in Abnormal Psychology, Psych 308. You've been oriented to the course, and now it's time to get down for the content. But first, before we get started, I wanted to just kind of introduce our first module here and also a general description of where we're heading in this class. So in Module 1, we're going to discuss what abnormal psychology is and how do we recognize disorders. And what we're going to do in this course is really spend the first 2 or 3 chapters trying to provide a framework for how we go about diagnosing these disorders and recognizing them and ultimately treating them. After we establish that kind of underlying kind of understanding of the concept, we're going to move the rest of the semester through specific types of disorders, and usually following kind of a predictable pattern of where we define the disorders, provide some examples of that, and then go into possible treatments if there are any. So this is first 3 are just really laying the groundwork. I think it's real important. They're more general than the disorders that you commonly think of. But without understanding that, it can make it more difficult to kind of organize all these disorders to make sense of things in your head. So that's where we're headed. All right, so kicking off, what we're going to talk about is a little warning first, and that is that this class could cause you to self-diagnose with a variety of disorders. It's sometimes been referred to as a medical student syndrome because a lot of the symptoms of emotional disorders share a lot in common with everyday experiences. So students in abnormal psychology courses, such as what you're in right now, are even more likely to kind of discover symptoms in themselves or others. You'll find yourself a mini psychologist going around diagnosing all sorts of people in your daily interactions. Now, the caveat here is that a majority of those diagnoses are not probably clinical disorders. And we'll talk about why. There usually has to be more than one symptom for one. And then there's a lot of other factors to consider. But it's good to kind of have your eyes out for it. Just don't panic and start internet searching real quick of all the implications of the disorder you think you have or somebody in your family or friends. Now, there is some real likelihood that you could have a disorder or one of your loved ones. The percentages would certainly indicate that at least a few people in your life have a diagnosed disorder because mental disorders are pretty widespread. So if you are generally concerned about your problems or those of a loved one, you probably will consult a lot of different self-help resources. There are a ton on the internet. Hopefully by now everybody realizes you can't trust everything that's going to be on the internet, and you really need to be kind of a critical consumer of any type of advice or descriptions that are given there. You need to kind of develop a sense of what is considered a well-respected resource and what is maybe more of a kind of quackery. So any treatment program suggestions, you really need to be careful about before you go online. Okay. That being said, I'll even have you taking some surveys to kind of judge where you are on things, because I think that's part of this class is really to kind of get a sense of how do we go about assessing these sorts of things, and then eventually we sure hope to treat. Okay. So when we're talking about abnormal psychology, this is the application of psychological science to study mental disorders. Okay. You have 2 different types of abnormal psychology. We have psychopathology. These are symptoms and signs of mental disorders. These can include things like depressed mood, having panic attacks, and even bizarre beliefs. And those all manifest in different ways with different disorders. And then you have psychosis. Psychosis is going to be a term for several types of very severe mental disorders where the person's considered to be out of contact with reality. Now, if you're really interested in psychosis, you're probably more interested in clinical psychology. People who deal with some psychosis, but more just general psychopathology, are going to be considered counseling psychologists. And my personal designation is school psychologist. So we deal with general psychopathology, but more focused on child, adolescent, or school age students. Okay, so that's abnormal psychology. Now, how do we go about recognizing if there's a mental disorder out there? Well, first, we got to define what a mental disorder is, and it's usually a set of characteristics or features. So, a single symptom by itself is really not enough to make a diagnosis. For example, you can have attention deficit hyperactivity disorder, and you may think, well, attention deficit, it's right in the actual name. So, of course, ADHD must be people who are extremely inattentive. And that's part of the picture, but I would never make a diagnosis based on just that one characteristic. In fact, I have a lot of individuals who come to my practice and think their child has ADHD, mainly because of the inattention. But I like to call inattention kind of your canary in the coal mine. If it drops over, you know it's not good, but you don't know what it is. So, inattention is one of those symptoms. It's not good to have inattention, but it can be caused by anxiety, can be caused by depression, can be caused by ADHD, can be caused by oppositional defiance. Okay, so we got to dig in further. That's why one symptom is not enough. Some of the other things that we need here is that there needs to be some sort of persistence of these maladaptive behaviors. So it can't just be being inattentive in a classroom with a particular teacher and not seeing it elsewhere, or having it only occur for a couple of weeks and then things get right again. This has to be very persistent over time. And time is very important, as we'll talk about in the next point here. Syndromes, now these are group of symptoms that appear together, and those are assumed to represent some sort of specific type of disorder. And so typically when we talk about things like generalized anxiety disorder or attention deficit disorder, what we're looking at are syndromes. And so we'll see that more when you get into some of the diagnostic criteria, primarily through the Diagnostic Statistics Manual of Disorders, the DSM. And so one of the important things that we look at here is duration. So how long are the symptoms manifesting themselves? Usually you have to have a minimum period where those have been active, but it varies based on what type of disorder or syndrome you're looking at. And then here is a real key. You have to have significant impairment, usually in some sort of social, academic, or occupational role. And so it's the impairment and significant impairment, meaning these individuals really have difficulty in the day to day world. And I'm not talking just about little roadblocks, but you eventually get things done kind of. I'm talking about significant ramifications for having this impairment. And when we hold it up to that light, the fact it has to come a long time and that you have to seriously be impaired, a lot of people who may think they meet some of these symptoms for a syndrome actually drop out. And it's just more kind of the human experience, typical kind of behaviors. So that's it for our very first module. Now we're going to have a couple more modules to go over chapter 1. And so I recommend go ahead and tune in for the next one there.